Dear students and my teacher friends, Namaskar. I welcome you to the presentation lecture on urine. Now, here in this lecture, what we are going to discuss. So, basically, we are going to discuss the volume, how much a normal healthy person urinate in a day, that we are going to discuss, and the composition of urine, that we are going to discuss, what exactly the urine is made up of, which are the solute or the ions are the present, what is the color, odor, then some disease related with the urine. All this thing we are going to discuss. Now, urine volume. Okay, see, an average adult person produces 1 to 2 liter urine per day. So normally, uh, the human being urinate 1 to 2 liter of urine per day, and if the urine output is greater than 2 liter per day, that condition is known as diuresis or polyuria. Now sometimes uh, fluid intake increases than the normal. That means a person is, let's say a person is drinking more water during the entire day, then due to the effect of some drugs. So in this case, a person may urinate 20 liter per day. Person who is suffering from diabetes may urinate 20 liter per day or more. Okay, then now we are discussing about the oliguria. What is oliguria? So if urine output is less than 500 ml per day, that condition is known as oliguria. And in case of anuria, what is anuria? So if urine output is between 0 to 100 ml per day, that condition is known as anuria. Now the reason for the low output of urine is, one reason can be kidney defect. Kidney is impacted, kidney is suffering from some disease. Another reason can be dehydration, that's why low urine is produced. Circulatory shock, circulatory system is not working properly. And if in a person body, if prostate gland increases in size, enlargement of prostate, that can be also the reason for the low urine output. Now if if urine output drops less than 400 milliliter per day, now in this condition the body cannot maintain a safe low concentration of waste in the blood plasma. That means a person is urinating very less amount of urine during a day. So that time, in in the patient blood, the amount of waste material is going to increase. Okay, and this will be a critical situation, and it can be unsafe for a patient, and this condition is known as azotemia. Okay, this is the azotemia condition, where the urine output is very low and the waste material are building up in the blood plasma of the patient. This condition is known as azotemia. Now the composition and properties of urine. What exactly the urine is made up of, which are the components that are present in the urine. So appearance of the urine, the look of appearance, how urine looks. Okay, so urine Generally, urine is colorless, and sometimes the color of urine deep umber. Now, the color of urine depend on a body's condition of hydration. Sometimes the urine color is yellow, and this yellow color urine, uh, this yellow coloration is due to the presence of urochrome. Now, what is urochrome? Urochrome is a pigment, and this pigment is produced by breakdown of hemoglobin. So, when the erythrocyte are expired, that time the hemoglobin which is present in this expired erythrocyte, that hemoglobin is broken down and a pigment is formed that is known as urochrome. So due to the presence of urochrome, urine color is yellow. Okay, now sometime the urine color is pink, green, brown, black and other color, and the reasons, okay, so all this information, if you are interested, you can read this entire information. If you are interested, you can read about pyuria, hematuria. Okay, so this is about the appearance of urine. Now we are discussing the order of urine. So fresh urine has a distinctive but not necessarily repellent odor. Okay, so generally urine is odorless, but uh, but if the urine stands, that means if urine is accumulated for a longer period of time at one place, so in this condition, bacteria are going to multiply. The number of bacteria are going to increase in this stagnant urine. And this bacteria, they are going to degrade urea, and urea is converted into ammonia. And when the ammonia is produced, so there will be a pungent odor. Okay, so the pungent odor is coming due to when the ammonia is formed. Now you might have experienced this pungent odor of the urine. Okay, what is let me highlight this pungent odor. So I would like to give you one example. See, uh, imagine in a crowded place where so many people are using one single public toilet. Okay, and time to time this public toilet is not clean, so that time what will happen, so urine is going to accumulated, it will be a stagnant urine, and here in this urine bacterial growth is going to happen, and due to that urea is going to convert it into ammonia, and the odor that will be coming out from that public toilet will be irritating, it will be pungent odor. So the uh, people who is going to visit this public toilet, he will experience this pungent order, and that will be intolerable. Okay, and sometime person may experience that the tears from the eyes are also coming out due to this pungent odor, so burning of eye due to this pungent odor. Okay, so this pungent odor also coming from the stale wet diapers. Okay, if the diapers are wet with the urine, so from this wet diapers also this pungent odor is coming out. Then some extra information about the odor, if you are interested you can read this extra information. Now the specific gravity of urine. Now what is a specific gravity? So ratio of the density of a substance, density gram per ml, to the density of distilled water is known as specific gravity. Now distilled water, pure water, has a specific gravity of 1, and the specific gravity of urine ranges from 1.001 when it is very dilute to 1.028 when it is very concentrated. Okay, so this is about a specific gravity. Okay, now the osmolarity of the urine. So urine can have osmolarity as low as 50 milliosmol per liter in a very hydrated person. So if a person is intaking a good amount of water, person is drinking some good water, so the osmolarity of urine can be 50 milliosmol. Or if a person is suffering from dehydration, so that time the osmolarity of the urine can reach up to the level of 1200 milliosmol per liter, and the osmolarity of blood generally 300 milliosmol per liter. So the urine can be either hypotonic or hypertonic to the blood osmolarity. Now the pH of urine. So generally the pH of urine is 6.0, but the pH ranging from 4.5 to 8.2. Chemical composition, the constitutes or the components of the urine. So in the urine, what is present? So 95% water is there in the urine, and 5% solutes are present in the urine. Normally the most abundant solute which is present in urine is urea, which is followed by sodium chloride, NaCl, then potassium chloride, KCl is present, and in lesser amount creatinine is present in the urine. Uric acid is also present, phosphates are present, sulfates are present, and traces of calcium are also present. Then magnesium is present, and sometimes bicarbonates are present. Now urine contains urochrome. Now what is this urochrome? So we have already discussed about the urochrome. Okay, in this first paragraph we have discussed about the urochrome, how they are formed, and now beside the urochrome, trace of bilirubin are also present. Now how this bilirubin is formed? So the breakdown of hemoglobin produces bilirubin, and urobilin sometimes present. What is urobilin? Urobilin is a brown oxidized derivative of bilirubin. Now in abnormal condition, sometime in abnormal urine, glucose is also present, free hemoglobin is present, albumin is present, ketones are present, bile pigments are present. So if in the urine all these substances are present, this indicate the diseased situation of the patient. Okay, that means if glucose is present, hemoglobin is present, albumin is present, if ketones are present or bile pigments are present, this suggests that a person is suffering from a particular kind of disease. Okay, now here one table is given to us. You can see this table. So table 23.2, properties and composition of urine. What exactly urine is made up of? So physical property, as you can see on left hand side, the value for specific gravity is given. Okay, then osmolarity value is given, pH value is given, then they are giving us the solute and concentration and output. Now here, as you can see, the asterisk mark, one asterisk, two asterisk marks are there. So what is this meaning of this asterisk mark? So here you can see typical value for a young adult male, and then two asterisk mark, that means assuming a urine output of a 1.2 liter per day. Okay, so here you can see the concentration and output. Inorganic ions, sodium, chloride, potassium, phosphate, ammonia, calcium, magnesium. Concentration is given, output is given. Then nitrogenous waste, okay, urea, creatinine, uric acid, urobilin, bilirubin. Other organics, amino acid, ketone, carbohydrate, lipids. Okay, so here you can see for urea the value is 21 gram per day. Okay, so normally when the person urinate, that means 21 gram urea is excreted in a day. Okay. So this is the table. Now here this is also the information regarding the urine, but this information is from another book, so you can go through this information. Okay, then here in second para all the ions are mentioned. Okay, then the third paragraph. Okay, now physical characteristic. Okay, urochrome we have discussed. Then the order of urine. Okay, bacteria. Okay, then here one table is given. Now in your textbook, in your NCRT textbook, these two terms are mentioned. One is ketonuria, and another term that is mentioned is glycosuria. So what is glycosuria? Okay, so in the urine, if the substance glucose is present, that condition is known as glycosuria. And the reason uh, for this glycosuria condition is that the person is suffering from diabetes mellitus. So if the person is suffering from diabetes mellitus, in this situation there is a presence of glucose in the urine, and this condition is known as glycosuria. Now second condition that we need to understand is the ketonuria. Ketonuria means presence of ketone bodies in the urine. Now why ketone bodies are present? See, excessive, here they are writing excessive formation and accumulation of ketone bodies. So why the excessive formation and accumulation of ketone bodies is occurring, taking place? The reason is starvation. Okay, so if a person is remaining hungry for a longer period of time, okay, let's say for a week or so, so that time these ketone bodies are going to develop and they are going to accumulate it in the patient body. Or a person is suffering from diabetes mellitus, so in this condition also the ketone bodies are present in the urine, which is known as ketonuria. Now some other conditions are also mentioned, but in your textbook this ketonuria and glycosuria, these two conditions are mentioned. So if all this remaining condition, for example this one, protein and hemoglobin and all this condition, so if you want to prepare, you can prepare. So all this information I leave it up to you. If you feel, you can prepare. Okay, so once again we are looking at this table. Then the information regarding the pH. Okay, specific gravity. Okay. This information. Table. Composition of urine. Okay, then this table, fast fact, the body at work. Okay. So with this we have completed our discussion on urine. I hope you have enjoyed this lecture on urine, and I also hope that this lecture will be helpful in your exam preparation and also in your studies. My name is Manish Koshi sir. I am from Ahmedabad, India. Bye bye. Namaste.